which is where all the controversy really lies. But instead, why do consenting adult men choose to get a circumcision? That is the question. Okay, so circumcision is a very controversial subject in the public space, and that's completely understandable. This video is not going to talk about neonatal circumcision, which is where all the controversy really lies. But instead, why do consenting adult men choose to get a circumcision? That is the question. The idea of this video came after a follower asked me if adult men patients of mine who got a circumcision chose so because of UTIs. And interestingly, that has never been a reason that I have performed an adult circumcision as a urologist. So I want to get into the most common reasons why adult men will choose to get a circumcision in their adult life. So by far the most common reason why an adult man would choose to get a circumcision relates to problems with a stuck foreskin, or a foreskin that is too tight and stuck over the head or the glands of the penis and won't pull back. This is called a phimosis. These individuals may have already tried conservative steroid creams to try to fix this, and it didn't work. And in a few cases, very few cases, the phimosis can get so stuck that it gets in the way of urination. It causes the urine to kind of be trapped inside the foreskin before it gets out. All right, I've seen it. It can exist. Another fairly common reason why adult men may elect to get a circumcision is just dealing with repeat or recurrent problems with inflammation, irritation, and or infection of the head, or what we call the glans penis. And this is called a balanitis. I'll do a separate video on balanitis, phimosis, and all the rest of that. But basically, this balanitis can cause swelling, redness, itching, burning, stinging of the head of the penis. All not pleasant. And though balanitis is often pretty easily treated with topical anti-yeast and steroid creams, issues with repeat balanitis may lead a penis owner to just be done with the foreskin altogether. And then there are some men who really just honestly would prefer to be circumcised for whatever personal reasons that they have. And that's okay. They are consenting adults that understand the risks and the benefits, which I clearly, and most of my urology colleagues, clearly lay out prior to surgery. Rarer reasons we may have to do a circumcision urgently include severe paraphimosis. Paraphimosis is when the foreskin is stuck down underneath the head of the penis, and it constricts the head of the penis like a tourniquet, and that can cut off the blood supply to the head. And this can be a serious condition that can become an emergent requirement for a partial or complete circumcision. The other reason why we might have to do a circumcision emergently is if you're unlucky enough to endure a penile fracture. That's when you have a bent erection that cracks and causes massive swelling and blood accumulation underneath the skin of the penis. Call this an eggplant deformity. We usually have to do a circumcision as part of the surgery to fix this injury. So if we have to take you to surgery for this and you're uncircumcised, unfortunately, most times you're gonna end up circumcised after the procedure. Whatever the reason is, let's be kind in the comments, please, and non-judgmental, and make sure you like this video and subscribe for more down there stuff every week right here. And I'm going to get busy operating. Bye.